Hello everyone, this is Dr. McKim here. Wanted to take some time to go over some good lower back stretches that you can all do to help out facilitate the adjustment that you've just received, or to try to alleviate a little bit of lower back pain or tightness that you may be having in between adjustments. This is for the lower back. Very simple, take a few moments or even less while you're sitting at your desk at work or even at home. All right, first exercise I'd like you to do is you're going to sit in a chair. I'd rather have your hips and knees about 90 degrees. I'm up a little too high on the table here, but for this purpose it's fine. And you're going to take one leg and cross it over the other, sort of figure four style. At this point you may already begin to feel a little stretch down in the glute muscle, and I'd like you to put your hands behind your knee and simply pull up and over to facilitate a little more of a stretch right into the lower back. Now, to get a little more stretch into the lower back, I'd like you to lean into it a little bit. This will give you a little bit more stretch into the glute, and it'll give you a little bit more stretch into the lower back. You'll hold this stretch for about 8 or 10 seconds and then release. You can switch legs, same thing, fold over figure four style, put your hands behind your knee, pull up and over, facilitate a little stretch into the glute, and then as you're pulling up and over, gently lean into it, and that'll facilitate a little bit more stretch up into the lower back. Please remember, never stretch too hard. You can actually bother it a little bit if you do stretch too hard. Now, this stretch can also be done lying back. Let's say you're at home. Good way to do it at work is when you're seated. Good way to do it at home is when you're lying on your back. You can do the same stretch just like this. Have both knees up, feet on the table, bring one leg over the other, grab a hold of the knee, and simply pull back. Try to let your head and neck rest back so you're not straining your head and neck. Again, hold this for 8 or 10 seconds. You're going to feel a nice stretch right here into the glute muscle. Hold it for 8 or 10 seconds, release, switch legs, cross over, grab the knee, and simply pull up and over towards your opposite side of the chest. And you'll feel a stretch down into the gluteal muscle. You want to hold that for about 8 or 10 seconds, and you're going to go and do both of those for about 3 or 4 repetitions each. I'd like to show one more while you're on your back for the lower. And you can also, while you have one leg crossed over here and have just stretched out the lower back, I'd like you to turn to the side and simply allow the lower back to stretch just like this. Now, if you were not on a table, it'd be a little easier. If you were on the bed or the floor, you can let this leg dangle and not risk of falling off. However, this is a good way to simply get some rotation. You may actually get a click or two into the lower back, and this works out great. You hold this again for about 8 or 10 seconds, and then you would turn and do the same thing on the other side right there. Hold it for 8 or 10 seconds and simply relax there, and then do both sides a number of times. Patients will also ask about simply rotation strengthening exercises, going back and forth, nice and slow and controlled. Do this for about 15 or 20 reps and relax, okay? These are great exercises to do. You can also do little pelvic tilt exercises, which are very important. I'm going to turn sideways to show this one. You need to sit up at 90-degree angle. Now, this is a basic core exercise, and this one's very, very helpful. You're going to sit up straight so that you're in perfect posture just like this. And as you take a deep breath and let it out, I'd like you to just let your lower back slouch a little bit. And then you simply round forward again. Slouch back, round forward again. Slouch back, think of it as sitting up straight, and then going into a slouching position. I recommend patients move at a pace similar to this. Get about 20 or 25 or 30 repetitions in, and I recommend patients doing this little core pelvic tilt exercise immediately after doing the stretching. It's a wonderful way to really strengthen the lower back, get some range of motion, keep everything feeling very good. Try these exercises 2 or 3 times a day. If you have any questions, please let me know. Thanks very much.